So this is Garden City, Kansas, where we're seeing officials, including the Kansas Governor, Laura Kelly, as well as folks with the Department of Health and Environment leadership, talking about the measles outbreak there. At last check, we were seeing some numbers, upwards of 3 dozen or so cases that were reported. And actually, coincidentally, just a few moments ago here on Live Impact News, we were sitting down with that health official from here in North Carolina talking about how they're doing wastewater surveillance for measles in West Texas, where they're seeing an outbreak as well. Let's listen in once again. This is Garden City, Kansas.
Adults over the age of 20, pregnant women, and those with a weakened immune system. Like we've all said today, vaccination is our best defense against this outbreak. The MMR vaccine is 93% effective against measles after 1 dose and 97% effective after 2 doses. Normally, we recommend receiving the first dose at 12 to 15 months of age, with the second dose given between 4 and 6 years of age. However, with this outbreak, we are recommending an early extra dose at 6 months for babies in the 8 affected counties and their surrounding counties. Adults who have not been vaccinated can get both MMR vaccines as long as they're at least 28 days apart. If you think you've been exposed to measles and are unsure of your vaccine status, please contact your healthcare provider as soon as you can, as you may be able to get an MMR vaccine within 3 days of exposure or an immune globulin treatment within 6 days of exposure, both of which would significantly lower your risk. If you have an exposure, then you would want to watch for symptoms like a fever or rash for 21 days. Stay home during that time and avoid high-risk places like schools, daycares, and healthcare facilities if possible. And if you do get measles, stay home. You are contagious from 4 days before the onset of the rash up until 4 days after when the rash first appeared. Do not go to work, do not go to school, do not go to any public places during that time. Ask your healthcare provider when it is safe again for you to be out in public around other people. And I can't stress enough how important it is to receive that MMR vaccine to protect yourself, your family and loved ones, and those in your community against this outbreak. We are continuing to work very closely with all of our local health departments across Kansas, local and state officials, the CDC, and healthcare providers to ensure the measles in cases are properly monitored and contained as best as possible. Lastly, we are continually assessing and evaluating our supplies, our availability of MMR vaccine, testing supplies, and to ensure that all Kansans have access to the health care they need to prevent measles, whether they are insured or uninsured. And with that, I'll hand us over to Dr. Clifford.
Thank you for having me today. Good to see members of a lot of our governing boards here today. Also want to introduce my colleagues from the legislature, Lon Pishney, District 122, and earlier I saw Bob Lewis sitting there with my wife Jean from Garden City. The governor earlier paraphrased a gentleman named Samuel Crumbine. Many of you haven't heard of him, but he was a very famous doctor in Dodge City, Kansas, around the turn of the century. In fact, he's viewed as the father of public health. The governor said the health of each of us depends on the health of all of us. And Dr. Crumbine really promoted that. He was instrumental in limiting TB spread. His famous phrase there was, "Don't spit on the sidewalk." In fact, they had it engraved in bricks. Because the tuberculum would be spread that way. He eliminated common drinking cups that would pass for water fountains in those days, and common
Sorry, folks, looks like we are getting a little bit of a hiccup in this live feed here. This is a feed that we were following out of Kansas. Just a quick recap. So this is state officials with Kansas giving updates on this measles outbreak, which we saw at last check entailed about 37 or so cases, none that have been fatal. It looks like the feed is back up. Is that okay? Looks like we've got it back. We'll send you back there now.
The legislature is still going to pay for that, so we can get those test results back very quickly to let people know if they have measles and what their quarantine ought to be. You know, I view this as the tip of the iceberg. The governor asked us earlier what our thoughts were. We do report 37 cases, but if you talk to anyone in healthcare, there are several people sitting at home with red spots. while one person who's the sickest is coming into the emergency room. So realize that it's out there. It is very contagious, and if you're not vaccinated, you ought to be. And we adults, as well as our children, need to go in and get our MMR. I do want to thank, again, Trudy for her response. The Health Department's doing a great job. I visited Bright Blue, which is the Tyson Clinic. Joanna Coronet has stocked up on MMR and is handling a lot of inquiries from employees. Visit our FQHC, Genesis. Dr. Selma Schultz there in OB, but she's helping with the response and the isolation, and Mary Gonzalez, who runs that. Also the EMS, there are folks here who are healthcare responders who can't avoid running into this disease. We have a new director there, Kenny Smith. I went to their meeting on Thursday, and they are responding very well to this outbreak. So as always, we kind of bootstrap ourselves. No offense, Governor, but we don't wait for help from Topeka. We take care of things here. I learned that long ago during the Tyson fire that, the cavalry does not arrive right away. We have to do self-help and mutual aid here, and we do a great job of it. I have not visited, but I've reached out to several of my counties in southwest Kansas, and they're having a similar strong, proactive response. So I think we can put a lid on this, but we certainly need the help of the community to do it. I think we're going to open this up for questions. The Governor and Dr. Totner come back up, and can't answer anything about Gaza, but happy to talk about measles.
Yeah, for those of you in the audience, if you have is it just be press questions?
For now.
Okay.
I was going to ask, did you get any new cases identified from exposure at Clarion Inn at all?
Let me go ahead.
As far as we know, there are none. We are almost out of the incubation period where folks exposed would have shown up with symptoms. So I don't know, Dr. Taunton, any comment on that?
That's correct.
Trudy, any comments from our public health officer?
We are continuing to monitor, but yes, like you said, we are close to the end of the incubation.
So we'd give it all clear at the Clarion, open for business.
I was also going to ask, I know you guys dropped that 37 number a few times. Do you have any updated number from like the last update on the website, or that you can share?
I'm sorry, the difference between the 37 and the last
Weekend or
the weekend.
testing.
I don't believe that there have been any additions over the weekend to that site.
We update the website every Wednesday.
So look tomorrow, because the website gets updated on Wednesdays.
We did have 2 negative tests over the weekend, so folks are coming in for testing, and I would highly encourage folks who have a high fever or, in the case of my practice, red watery eyes, don't come into my clinic. Go to the health department and get your drive-up testing, because we don't want you inside a PEDS clinic, the public health clinic, or any medical facility spreading the virus. But our health department has excellent drive-up testing, and folks should avail themselves of that.
I was going to say, that you held a presser on this today and everything. I'm just wondering how this outbreak compares to past years and why you felt like you needed to talk about it today specifically.
Well, we haven't had any measles in Kansas diagnosed since 2008, so there has been no need for this. I think the fact that we have 37 documented cases, and we have no idea how many other cases there might be out there, that it was important for us to bring together the state and local and medical to let the people in this region know what's going on and what they can do to protect themselves and their children.
With, of course, how easily measles spread, is the state preparing for it to spread beyond just southwest Kansas?
Yes, as I mentioned, we are in very frequent, regular communication with the local health departments, having weekly meetings to help address questions in Southwest Kansas, as well as holding regular meetings with other health departments around the state, trying to engage healthcare providers, but really increasing the awareness, because one of the best things is, of course, as we've talked about all today, is really making sure we're getting those doses of the measles, mumps, and rubella vaccine that offers excellent protection against this disease and is really our best defense at stopping this outbreak.